Hello, my name is Dr. Trudy. I hope everybody's doing well today. We're going to do our webinar right now on a new healthcare solution for your business. It's provided by me, Dr. Trudy, here at Balanced Physician Care. And what we really want to be able to present today to everybody who's listening is what we believe is a new healthcare solution. Healthcare costs are rising. Small business owners want to be able to keep good employees and be able to offer them benefits that allow them to stay at your company. And so what can you do in the face of rising healthcare costs that's affordable as a small business owner? And we're here today to present to you what we think is a very viable and brand new solution that's come out in the market. And that's direct primary care coupled with a unique health share catastrophic option. So my name is Dr. Trudy. I've been a physician for over 17 years. I have a lot of different board certifications. I do standard general family practice medicine, sports medicine, as well as I've integrated holistic or integrative medicine in what I do at my practice. And I also have training in acupuncture. I'm a private physician. I've worked in the hospital setting, employed as for a hospital. I've worked as a private physician, employed for a private physician group. And now I'm in practice for myself here in the Jacksonville area. So we're here today to talk about direct primary care and why it's your solution as a business owner. So what exactly is this direct primary care model? You might have heard about it. There's a lot on Twitter, Facebook, several NPR, Wall Street Journal have featured articles on this, and it gets a lot of press sometimes in the news when talking about a new healthcare. So direct primary care is really a different way of delivering healthcare. It's growing throughout the country. When I started my practice in this type of practice model, there were probably only about 600 practices throughout the country. Now there's over 1,300 practices as this model of care is growing. It's certainly on the minds of your Florida legislature here in the state of Florida. They've passed several bills that have been very friendly to having direct primary care as a business model grow and as a healthcare solution. So what exactly is it? People have heard a lot about concierge medicine, and when they hear about direct primary care, they jump to that. But we're not really concierge medicine. Basically, direct primary care charges a periodic fee, which is either monthly or quarterly or yearly, in exchange for a menu of services. We often like to call it a membership-based practice, but it's not concierge. Often concierge medicine bills third-party payers, and often the monthly amounts or yearly amounts are much higher. And that's what distinguishes us, is that it's a affordable monthly price, and we don't bill any third-party payers. So why is this type of model growing? I mean, what's the attraction? Why are you as a business owner or you as an individual be interested in direct primary care? Well, we've kind of, put together what we feel are kind of the three top reasons why anyone might be wanting to pay attention to this and consider it for themselves and for their employees. First of all, there's a big, huge growth in the self-pay market for healthcare, and we'll talk a little bit more about that. And so there's a drive for transparency in the healthcare dollars that we spend. And so as a result, there is a drive to try to reduce costs, because healthcare is such a costly proposition. We also believe, though, that direct primary care does that, but also offers a very high quality product that can actually been shown in studies to improve outcomes in patient care. And I think that is worth paying attention to, and we'll go through that as we go through these reasons. So first of all, let's talk about what the market is right now for a small business owner or an individual. I mean, there is a big emergence in most people paying out of pocket for healthcare. 10% of people are uninsured. Obviously, they're paying out of pocket. But in 2016, there was the CDC reported that 40% of people have high deductible plans. So if you have a high deductible plan that is topping out now at $8,000, $10,000 a year, you are paying cash for your health care when you go in. And there just are a lot of offices out there that just are not designed to be able to manage that type of model. And that's really what direct primary care is doing. Is it is really a new way of addressing the fact that most people are paying cash now for their health care. So, as a consumer, if you're paying cash, you ask yourself, is my experience really the experience that I want? I mean, what is your healthcare experience, like? And can it be different? And one step further, should it be different? So let's talk about it. I mean, I've been in the private sector for many years and in academic medicine. And what is it like? Well, typically, right, you don't get to see your doctor right away if you need to. If you got something come up, it's really hard to get a same day or next day appointment. For most people, you really are looking at, waiting weeks to a month to see your own physician and not necessarily someone else in the practice. And what happens, if you have an urgent issue, you're often told to go to an urgent care or an ER because there just aren't appointments available. So again, you're not seeing your own physician when urgent issues come up. And when you go to the office, I mean, most of us are waiting, half hour, 45 minutes or more to see the doctor or a provider. And then when we get in there, the time crunch is only about 10 or 15 minutes. And that just leaves us enough time, as providers to ask a few questions, write a few prescriptions, not much time for explanation or discussion about what's going on. And, you as a patient, when you come in, because you can't be spending 45 minutes to an hour in the doctor's office on a monthly basis, you end up, having a big list of issues that sometimes don't get addressed as we want to, or as we believe that they should be for quality care. So, direct primary care really says that we can do this better as a membership-based practice. With direct primary care, it is all about personalized medicine. We try to spend as much time with you as we can. We certainly, may split up a visit into, an in-office visit and a follow-up with a telephone call within a day or two. But we really do spend as much time with you as you need to make sure all your issues are resolved. And we make sure that you understand what your options are and whether you want to take this medicine, whether you want to get this test done, what are the costs. And we get to know you individually as a person well, because we're only taking care of, in this model, 400 to 600 patients. I mean, your average primary care physician or provider might be taking care of 1,000 or 2,000 patients. And that is a lot of information in today's day and age. Just for the 400, or so patients that I take care of, there still is a lot of information. And so imagine quadrupling that and being able to try to manage all that information. And that's often where problems, occur. So there is definitely direct evidence that with this type of model, personalized care, smaller patient panels, that it improves patient outcomes. There have been studies in the British Medical Journal that have showed that patients that are part of a direct primary care practice result in 66% less specialty visits, 65% less ER visits, 35% less hospitalizations, and 82% less surgeries. And that is a big, outcome difference that proves that quality truly is one of the major benefits of being a part of this type of practice. But all their benefits include, convenience. We're there for you via email, via telehealth, so that, you don't have to come into the office. There's a lot of things now online that we're able to take care of. We were doing telemedicine before this current pandemic, and we will continue to do it afterwards and integrate it as a part of what we deliver for our patients. And you have direct access to your physician. So if anything comes up with staffing or refills or something you see on TV, you can just shoot an email and your own physician is going to respond, not just a staff member who's screening those emails for the provider. We really pride ourselves on working on improving communication, helping you coordinate things. The other piece of what we do is we provide cost efficiency. And how do we provide cost efficiency? Well, we're eliminating the middleman first and foremost to begin with. Our membership rates are lower because we've eliminated the middleman, and we reduce overhead. And so that, makes a big difference. If you have to go to the ER less, if you have to go to the urgent care less, that obviously is going to save you money. But we also work in the community to find discounts on X-rays, MRIs, and labs. And so we are working at our office, at our direct primary care membership, to help to save you who purchased this membership costs on those types of things. So, this again is kind of this whole wheel of direct primary care. I know it's a busy slide, but again, it kind of outlines, same day, next day visits, avoiding the urgent care costs, discounted labs, discounted procedures. All of our procedures are included with our membership, flat monthly transparent fee that, includes procedures, includes office visits. So again, the main reasons why direct primary care is growing and why I encourage people, to look at it is, it provides that quality care, and there's studies that show that it improves quality of care. It reduces costs, again, by being able to go into the community and find the discounts for these, types of services that you're needing to take care of your health. We make it convenient for you, and we're reducing the third-party excess, essentially. So our name of our practice is Balanced Physician Care, and our goal is to make, healthcare hassle-free. So, as a business owner, why, are you looking at why would you be looking at this? Well, direct primary care has also shown, not only in the world of quality, but has shown in the world of cost efficiency, to lower claim costs for employers. And it definitely is a benefit worth looking at. It provides your employees with reduced ER visits, reduced costs for unnecessary care, and it lowers costs for employers. These are the reasons why, as an employer, you'd want to offer something like this. It can save you money over traditional healthcare. Obviously, providing your employees with a benefits package of healthcare can reduce absenteeism. It is a convenient option for your employees, so they don't have to be running off and spending hours at the doctor. It's there at their fingertips. It helps you as an employer retain the best employees. It boosts employee engagement as they feel better, as their issues are addressed. There's a lot of focus on wellness, and it heightens, job satisfaction. So this is us, balanced physician care, direct primary care. This is what comes with it. And I know it's a busy slide, but we just wanted to be able for you to see that slide and see what it includes. Again, to go over, we provide 24/7 unlimited access on nights and weekends. So that, again, that reduces urgent care visits or ER visits. So if your employee has an issue on Saturday at 2 o'clock, you can give us a call and we're going to address it, triage it, see what we need to do to take care of it for the weekend. And if that means coming in, we will do that. If it means setting up an appointment for Monday and calling in a prescription in the meantime, we will do that. We offer same day and next day appointments to people. So, if you have a call in the morning and you have an urgent issue, we keep 1 or 2 time slots, there, for employees to be able to, come in and not have to go to an urgent care. In our flat fee, procedures are included. Our visits obviously are all included, and they're relaxed office visits with the time to address what you need. We again offer telemedicine, telephone, email, all those points of communication to make it more convenient for you. We obviously provide the whole wide range of services as a primary care doctor, comprehensive physicals, wellness, well-woman exams, pap smears, travel physicals, sports, camp physicals. We do pediatrics. And then again, me at my practice here at Balanced Physician Care, I do a lot of holistic medicine, integrative medicine, and hormone replacement therapy. And we offer that as an option, again, for people who are interested. Even if they're come in through an employer, they have an option to choose a second tier if they want to receive these extra services. And I won't continue to go on, but one of the things that we also do is we can include a basic set of labs. So, this is our pricing schedule if you're a small business. If this has caught your eye and you're saying, hey, I might want to be interested in offering this to my employees. I not only for myself, not only for maybe my significant other, but maybe the 1 or 2 other employees or 8 or 9 other employees that I have. This is what our pricing fee is. And you can see, obviously, as with anything, the more people that we enroll, the bigger the discount that we provide. And so this is our monthly pricing. We have a basic membership and a premier membership. The basic membership is just your basic average primary care. My nurse practitioner, Arlene, and I administer, that basic membership. And, it is your basic included primary care. The premier membership is more about more of that hormone replacement and holistic, type of treatment if you're interested in that. And we certainly, if you have an interest, can go over all the details between the 2 plans. So we talked about direct primary care. We talked about what we offer at Balanced Physician Care and how our membership works. And certainly for most of these types of memberships, as a primary care physician, I can take care of 80 to 85% of what your healthcare needs, being a broad-based, trained physician for over 17 years. But obviously, issues come up, right? We have catastrophic things that happen. We hope that we're going to try to avoid it at all costs, but there still is, catastrophic things that come up. So what we look at is what can you couple as a business owner with our membership to provide that catastrophic coverage. So obviously there's traditional insurance plans, there's high deductible plans. And for large corporations, there's a self-funded plan. And we'd be happy to talk more about, for those who might be large business owners who might be interested in a self-funded plan, how direct primary care can reduce costs and, allow and reduce your utilization, which obviously, if you've been a part of a self-funded plan, then reduce your costs as a business owner. And there are a lot of studies and a lot of models out there where that's been done, and we'd be happy to talk about it. But as a small business owner, I really think that the health share option is something that has emerged as truly a solution for the small business owner. So we couple with, there's a lot of different health shares out there, but there's one health share in particular that has made itself very friendly to this direct primary care, balanced physician care, primary care model of membership, and that's Sedera Health. They've really positioned themselves to provide that catastrophic care. So you can see on one side you have us, who are really working at the grassroots primary care level to reduce your costs. And here now you have Sedera providing that care in case there's a catastrophic need. So let's talk about what a health share does. I'm not sure how many people, are familiar with the concept, but I'm going to try to go through that so that you can understand, because it's not health insurance and there are a couple of differences. But it's what is called as a health share. So a couple of terminology is that medical cost sharing is the concept that all the members in this group pay a monthly fee, and they call that a shareable amount on a regular basis when they sign up. And then the health share collects that as a community and holds on to that money. And then when there is a need in the community or a medical expense caused by a single accident or illness, then that person goes to their health share and says, I have this bill. And then the health share, according to the rules of which they signed up and according to the plan that they pick, will pay, those bills. So sharing is done on a per need basis. So unlike a yearly deductible that has to be met in an insurance plan, in a health share, it's all about your initial, what your need is, your event or your need. And you sign up on plans where you agree to a certain initial unshareable amount that you pay. And then once you pay that, the health share then will pay the rest of the bills by that health sharing amount. So let me give you an example, because examples are probably worth 1,000 words of explanation. So I like to use the example here of a broken arm, but this is a great slide because it gives you a couple of different examples, stuff from something small to something long-term like a pregnancy to something severe like a heart attack. So let's say that you chose the 1,500 initial unshareable amount plan, for lack of a better term, and you break your arm. So it's the weekend, you're a direct primary care member, you call me, it's Saturday, there's no place to go get an x-ray, and it's significant enough that you need to go to either a really good urgent care facility or you need to go to the emergency room. And so obviously, I don't know any ER whose cash pay price when you walk in the door is only $2,000. But let's say, for sake of argument, that your ER visit costs you about $2,000 and that the x-rays only cost you about $250. And so you've paid out that. Those are bills that you've gotten because of this broken arm. Obviously, the ER does what they need to do. They treat you. They don't need to keep you overnight. And then you need to follow up. And so you've got several follow-up visits. There's a prescription that's associated with this for pain. And, your total bill, comes up to be, what's reflected on the screen. And you have your unshareable amount at $1,500. So you get the bills, what they do is they have you submit them to them. They will go back to the hospital or the ER. They'll negotiate the rates down for you because it's in their interest to not only negotiate it for you, but for themselves as well. And then when that's finally come to a decision, you just have to then just pay your unshareable amount of those bills, and then the health share will pay for the rest. And as you can see in this particular example, that's $984. But let's say you still have, over the next 6 months to a year, some more follow-up visits that you have to do. It doesn't matter if the calendar year flips over. It's all part of that same initial event. So that's a little bit unique, is that it goes by events. There's also some other ins and outs, as we get into, health shares, about, when you have an issue, and if you're a direct primary care provider and you need to see a specialist, especially if they're looking at doing a significant procedure, there's some second opinions and things like that that are, part of the Sedera protocol. But again, I think this is a really great, example, because when you look at the rates, compared to what an employer is paying for a monthly premium for health insurance. I mean, this is what we here at Balanced Physician Care, working with Sedera, can offer for a great option of total health care with catastrophic coverage. So here, if you pick a $1,000 initial insurable amount type plan, instead of a deductible, it's again an IUA per event. Your monthly cost for both our membership and the health share coverage for an employee under 30 would be $206 a month, and over 30, $236 a month. And that includes both pieces of the puzzle. And, I know that for a lot of health insurances, there's not too many premiums out there that are at that price. So again, I think this is definitely, there's obviously some differences, some different ways that it's handled, but I think it's a very competitive thing as a business owner to look at, to purchase for yourself or for your employees. And again, there's certainly subtleties. And so if this has caught your eye, if you have an interest in this, we'd be happy. Give us a call, send us an email. We'd be happy to, set you up with a meeting with us and go over and answer all of your questions, on, again, how this really can be a very viable, alternative for the small business owner. So, so this is us, this is our practice, this is all the unique things that we do here. We're located here in the Jacksonville area at the beaches, and we obviously, this is our whole group and our whole staff here, and we really believe that in what we're doing is providing quality care and really looking at solutions for business owners and individuals when it comes to healthcare. So thank you very much. I don't know if anybody has any questions. I'm just going to take a second to look through to see if anybody has any. If you do, please feel free to type up any questions that you might have. All right, I don't see any questions, but again, hopefully this has sort of sparked your interest in what direct primary care and a health share can do as a solution for small business. Please reach out to us by email, by phone, and we'd be happy to chat with you and go over it a little bit more. Thank you very much for joining us this afternoon, and I hope all of you have a great day. Bye-bye.